I'm Dr. TruthSayer, and I'm presenting on Transcendental medicine, which is the medicine that I created and use in clinic. And I thank Nawaz and the 6th Global Scientific Guild for the opportunity to present. Thank you so much. Let me put this onto slideshow. There we go. Great. So it might help if those of you who are practitioners think of a thorny case, a difficult case, how you would treat it. If you're not a practitioner, think of yourself and maybe a difficult health condition, particularly one that's chronic or repetitive, and think about my lecture in those terms. It may help. So today I'm going to tell you more than I would normally tell about my bio, because my background is how I created this medicine. So I'm going to tell a little bit more about it. I'm going to talk about cases, and hopefully I'm going to answer in this lecture, what is transcendental medicine? And because auricular medicine is such a big part of it, I'm going to explain a little bit about auricular medicine. If you really want to know more about that, I have other lectures on auricular medicine. Then I'm also going to answer the question of what is comprehensive medicine in transcendental medicine. So my background, so I have a doctorate in acupuncture oriental medicine from ACTCM, one of the oldest and most respected schools of Chinese medicine in the United States. Also a 4-year master's degree in Chinese medicine prior to that to get into the field. I'm former faculty at ACTCM and a disciple of Dr. Huangli Chun. And Dr. Huangli Chun is the world's most top expert on auricular medicine. She coined the term auricular medicine. I studied classical Chinese medicine with Jeffrey Yuan, an 88th generation Taoist priest, and Elizabeth Rochat de la Vallée, a classical Chinese medicine and philosophy scholar in France. I created transcendental acupuncture and transcendental medicine in clinic based on classical Chinese medicine, shamanism, energy medicine, and psychology. Going on. Shaman. I am a shaman. The word medicine in Chinese originally meant shaman. That's how fundamental shamanism is to medicine. Shamanism really focuses on energetic levels and focuses on mind, body, and spirit. So I have a long background as a spiritual teacher, healer, and especially alchemical spiritual healing. And so I'm going to explain a little alchemical spiritual healing. The alchemical process was the process of changing base metals into gold. And alchemical spiritual healing is the same concept, but it is transforming basic beliefs, emotional processes, mental processes that are inhibiting us or are part of wounding, and transforming that, not just healing it, yes, healing it, but also transforming it into health, into using the analogy into gold, but into our strength and into the best that we can be. So that's what alchemical spiritual healing is. I'm also a psychotherapist, so I've got 3 master's degrees in counseling psychology. I won't go into all the details, but I've got an over 30-year career in mental health and all kinds of certifications and all kinds of somatic therapies, EMDR, all of which are really profound and really good, but nothing went to the deepest level that I wanted. So in Chinese medicine, in Chinese medicine, classical Chinese medicine, able to get to literally to where spirit infuses matter in the body and move energy. When I do that, I call it transcendental acupuncture, because the acupuncture is really the study of moving energy in the body. And again, I give a whole lecture on that, but that's what, when I'm using it in that way, I call it transcendental acupuncture. And also I created transcendental essences, which is just homeopathy, but when it is used focusing on the spiritual, mental, emotional levels. So I can give treatments with transcendental acupuncture that go into the body, the deepest levels where spirit infuses matter and initiate shifts, and be a catalyst for shifts that transform consciousness. And then using homeopathy, working vibrationally. And that's what I loved about, I think it was Dr. Connor or Connolly, her lecture on water, because it's showing the energetic shifts in a concrete fashion that those of us that work with energy medicine are working with all the time. And when people can actually see it, they would have a better understanding. But even if you can't see it, it's the homeopathy is working on the etheric level and working in, it works in from the etheric spiritual level into the mental, into the emotional level, into the mental level, and then into the physical level. So these two are working in a similar fashion from two ends. It creates really powerful shifts in consciousness. So what is transcendental medicine? It is a conceptual framework and a system of medicine for the treatment of body, mind, spirit. And it has as its goal a transformation of consciousness. It is based on the concepts of Huangdi Neijing, and according to the Huangdi Neijing, to go to the deepest level is to go to spirit. That the deepest level of all disease or illness has to be at the spiritual level, and so going to the deepest levels and creating a shift in consciousness. Why? Well, Albert Einstein says that the answer to a problem is never at the level of the problem. So so in order to fully shift a problem, you need to transcend. So going to the root in Chinese medicine is going to the Shen, or the spirit level, and then producing shift in consciousness with alchemical process creates a transcendence. So that's why it's called transcendental medicine. And the treatment in transcendental medicine is based on knowledge and treatment modalities of Western medicine, Western psychology, energy medicine, auricular medicine, which I'm going to explain shortly, traditional Chinese medicine, classical Chinese medicine, homeopathy, scalp acupuncture, transcendental acupuncture, transcendental essences, and shamanism. So I'm going to talk about a few cases. I'm going to talk about, for instance, a patient that had lifelong allergies to animal dander or animals, and I had invited this person to my home for a shaman medicine ritual, so everybody was there. She arrived, and within 5 minutes of being in the house, her eyes are red, watery. She's sneezing. She's really miserable within 5 minutes. And so I invited her into the clinic in my home, and I did an auricular treatment for her symptoms, for the allergic reaction. And then she her symptoms were relieved. She came in and sat in my home for a 4-hour shamanistic ritual for healing, very, very deep healing. And for 4 hours, she had no symptoms. For 4 hours, no more tearing, no more pain. She left 7 years later, still no more allergies to animal dander. And I've since talked to her even more, and nothing has come back. I have patients that come to my clinic every year for hay fever. What's the difference? Why do they come back every year? Granted, my treatment works, they are relieved, and it helps. Herbs can also help, but they're back the next year. Or skin allergies, they come, the treatment, they're better, and then they come back next time. What's the difference? The difference is treating all levels, mind, body, and spirit. When this patient was treated, she sat through a 4-hour in-depth shamanic healing process, and her allergies were part of it because she had such an allergic reaction. So that is an example of transcendental medicine. It's a very short example, but it's an example of treating the whole, getting to the root and eliminating the problem. I'm going to talk about another patient, came in with digestive issues, stomach upsets, really stagnation in Chinese medicine. But this patient, when I evaluate, I'm gonna tell you how I do the auricular evaluation. But the patient comes in, I know nothing about them. They fill out paperwork, and my assistant has that. I know nothing. I do an examination of the exterior auricle, and I'm telling them everything going on with them, including mental emotional disharmony, and all of which can be seen on the exterior of the ear. And so I'm doing that evaluation before I'm treating to see the whole of the person, mind, body, and spirit. So she come in with digestive issues, but there were also very in-depth psychological issues going on, and also stagnation. So this person was stagnant in her job. She was very talented, very creative, but her job, she was stuck in an area. She was bored to tears and wasn't making any progress for years. She did not have an intimate relationship. She had issues with her mom that she really wasn't even that clear about, but that were part of the stagnation. And her life, she just felt like it had come to a dead end. And so gave her a psych eval, started some therapy, did a transcendental essences and a transcendental acupuncture treatment, which I was saying, works from the etheric level and from body level. And that started to create shifts where she herself initiated shift in lifestyle and diet. She asked for suggestions for diet, but I wasn't having to push. She was asking me, she was making shifts. She was starting to exercise because she was having more energy. So it creates this, if you want, instead of a negative cycle down, it starts to create a positive cycle up. And she started losing weight as a byproduct. She wasn't even trying to lose weight. And so I was using traditional Chinese medicine for the physiological issues and the other therapies, and her whole life started to shift and change. She created a whole project that she presented at work. They gave her authority. She wound up creating a whole division where she worked. She was excited. She was enthusiastic. She was very successful. She adopted pets, created relationships, and eventually went on to start dating. Her relationship with her mother shifted entirely, became very positive. Her whole life, bit by bit, just entirely shifted. And of course, her stagnation was no more, digestive issues no more, and was no longer overweight. Neurological issues. A client came in with perimenopausal symptoms, and upon investigation, also had depression. And she also felt stymied. Her relationship with her husband was keeping her stuck. She really wanted a career. The children were older. It was time, but her husband was not supportive. She didn't have any faith in herself and had some deeper psychological issues. So work with this patient. It took about maybe two months to shift the hormonal issues with Chinese medicine, and worked with the psychological issues to create a shift. Maybe it took about 6 months. She shifted entirely her whole life. She went back to school. She had confidence. She learned a whole career in graduate school, found a very successful job. She was shifting everything. So I don't know exactly how much time, but it's maybe around 6 to 9 months. And then the deeper level issue, it showed up in the initial exam, but the patient wasn't ready to deal with it. So we didn't. After those issues shifted and her whole life was different and her whole being was different, she came back in. Maybe it was just some back pain or some other thing, but upon examination, I said, we really need to deal with this old accident issue. She had never told me all of the symptoms related to it. I had just diagnosed an accident that she had on the original intake. I had seen some neurological effect and some musculoskeletal remnants from this accident when she was 9 years old, fell off a bike, had a head injury. So she gave him permission to start treating. And after the very first treatment, so my assistant saw some things and mentioned it to me, and I actually hadn't even noticed. During the treatment, her toes, she was moving her toes on, I think it was the left side, and her whole left side had been affected. She hadn't been able to move her toes since 9 years old. She hadn't been able to use her arm in the same way that she could use her right arm, her whole left side. Her face, her smile wasn't accurate from really facial nerve injury. But most interesting, so after the first treatment, she was playing with her son Frisbee and went to catch the Frisbee with her left arm. She had never done that since 9 years old. And she never even thought about it. She just accepted things the way they were. She caught it. But not only that, after more treatments, she was telling me that she had had cognitive difficulties that she had never mentioned, difficulties communicating, putting words together sometimes, that completely cleared up from the neurological treatments. That's the power of scalp and auricular medicine and treatment, particularly for neurological issues. But the Gestalt is transcendental medicine, being able to see the whole of the person and how each level is interacting. So not only her life changed, but she was able to have a new level of functioning in her 50s. Really phenomenal stuff. So I'm going to save time, and I'm just going to talk quick about the recurring rash. The recurring rash was a patient came in with a really bad facial rash, like the previous person was talking about, eczema, red, bumpy, itchy, really uncomfortable. So I always explain to patients that I would prefer to treat to the root and to go deeply into the issues, but not everybody is ready for that, willing. So this patient really just wanted symptoms treated. So gave auricular treatment. Within a treatment, the rash dies down, the patient's back to normal and is very happy and goes away. And, you know, and I recommend to change the diet and so on. Patient comes back in 2 weeks, same condition, and I reaffirm, let's change diet, let's look deeper. Patient was just happy to have the symptom removed. And once again, patient comes back in about a month, and I harp a little stronger on diet, especially alcohol needs to be removed. And the patient doesn't show back up. And, you know, it's an example of the fact that if the deeper levels are not addressed, the problems will often recur. And if they don't, they will often transfer into a different condition. So instead of the face, the rash might appear in other parts of the body, or it may change from a rash into a stomach problem or into a headache. So that is why I really endorse deep treatments and treating the whole enchilada. So I'm gonna talk a little tiny bit about Huangdi Neijing. In the Huangdi Neijing, which is the Bible of Chinese medicine that goes back thousands of years. So it's taught in school, that's about 2,500 years old, but actually in burial sites, they have uncovered tracks from the Huangdi Neijing that dates like 7,000 years old. So we don't even really know how old, but it's old. So according to Huangdi Neijing, the basis of health is the right relationship and the right proportions of 天人地. So on the macro level, 天 is heavens, greater consciousness, spirituality in Chinese, in philosophy would be the Tao. Ren is humanity, person, humanity. Di is the environment. So the relationship of all living things, of pollution or non-pollution, so everything affecting the whole web of life, the whole planet. So that has to be in right relationship for there to be health and harmony. If there isn't, there will be illness. And then on the micro level, within the person, there needs to be right relationship between your spirituality or your spirit and spirit's relationship with greater consciousness, the person, your personhood, and your immediate environment, the people in your environment, the pollution in your environment, how that affects you yourself. So that's what health is. And what is required of a good doctor. So that in Chinese medicine, the most basic level is treating the symptom. That is not bad or wrong. In fact, I give a lecture on what I call target acupuncture, which is just treating the symptom. Getting very good at treating the symptom is wonderful, but that is the most simplistic level. In Chinese medicine, the deepest level is going to the root of the problem, which is spirit. And that requires, according to the Ling Shu, mastery of 13 aspects, which you can't talk about now, no time. But it's a practice that the practitioner needs to master of Qigong and of understanding the relationship between Tian and Di, which I just talked about. And that will give you the ability to touch the soul of the patient and to work on that level, which is shamanism, but it's Qigong. And it's the ability to recognize signs and symptoms of pathology and to negotiate communication of spirits. In Chinese medicine, there's 5, but basically to be able to communicate on spirit and physical and emotional, mental levels. Okay, so again, transcendental medicine is conceptual framework, goes to the root of the disease with the goal of achieving a transformation of consciousness. And it systematizes the functioning of the different levels of disease, and all systems need to be addressed. So looking at this mobile, each one of those little parts are a system a biosystem, including the mental functioning, and that star at the top you could call spirit. So all of those levels are interconnected. So if any one of them goes out a little bit, you can see that that's going to pull on the whole thing. So in a disease process, it gets pulled out of harmony. And in a healing process, when you're addressing the part that is disease, you have to also consider how that affects all the other parts, because there's a process of coming in back into harmony that there's a synergy of all the aspects. So as you move in one part, it's going to affect everything else. And if that isn't addressed, that might prevent more progress from happening. So you have to be treating the whole enchilada. And you have to be considering and understanding that whole enchilada. That's transcendental medicine. And this is in auricular diagnosis, when you're looking at the external ear, these are the systems, the biosystems that you are looking at. The reproductive system, urinary system, liver, gallbladder, pancreas, the digestive system, the abdominal cavity, cardiovascular system, respiratory system, 5 sense organs, endocrine system, neurological system, brain, limbic system, which includes your emotions, your nervous system, the muscular skeletal system, the immune system, and the skin is part of that. So the skin, you're looking at all of that on the external ear. And when you think of the mobile, each one of those is one of those systems, right? That's Dr. Huang Li Chun and myself. I followed her for 10 plus years until her unfortunate passing. It's really hard to even come to terms with her passing. She's a giant. You can think about the ear in terms of the, I wish I had a pointer, but you can see that the whole human body is represented and you can see everything. Dr. Huang calls it the Chinese MRI. This is Dr. Huang's method that you use for diagnosis that covers every system on the ear. This is just a small case, just to give you a little idea. This was an Alzheimer's patient that I was treating who, due to the Alzheimer's, did not have a lot of communication skills. And she came in one day with redness, as you can see at that, a little bit of the outer ear there is a red area. That area is the chest area. And so I asked the patient if she could lift her shirt because I was concerned about her chest area. She lifted her shirt and she had a rash that went deeper and deeper red and was more and more severe the more it went up. And she wouldn't have been able to tell me about that, due to the Alzheimer's. If I didn't have auricular medicine, I wouldn't have known about it. I would have just been treating her for Alzheimer's. But because I could see it, I treated. The next week she came in and you can see there's no more redness. There was no more rash. She was fine. That's just a little example. This is one of my teacher's pictures. There is a lump that you can see on the left side on the ear. That's the cheek area. And then you can see the patient has a tumor on the cheek area. So there's a correspondence from the outer ear to everywhere in the body. Okay, so with transcendental medicine, I'm going to assess with the auricular exam I talked about. I'm also going to do a regular TCM exam. If I see the need, I'll do a psych eval. If I see the need, I will do a homeopathic evaluation for the transcendental essences. And I may send the person out to get Western medicine labs. The treatment levels, I'm going to treat mental, emotional issues with psychology, transcendental essences with traditional Chinese medicine or classical Chinese medicine, and traditional and transcendental acupuncture. I'm going to treat spiritual issues with that alchemical transformation process I talked about, with meditation, teaching people skills, teaching Qigong, create a practice for the patient, right? Physical issues, I'm going to treat with acupuncture, herbs, diet, lifestyle, and medical qigong. I'm going to skip this case and go to one last case to talk about a patient with 30 years of debilitating migraines. So this patient was in her 50s, and she would have 2 to 3 debilitating migraines. So she could not function. She had horrific pain. She was on Western meds for the migraines. With 2 or 3 migraines a week, she was basically non-functional. So she would work in between her migraines. So she was really in a bad condition when she came. And she was on bioidentical meds for perimenopausal symptoms that were pretty severe as well. So I started treating her on the physical level with auricular medicine and traditional Chinese medicine. I dealt with the psychological, emotional issues of how the patient handles her anxiety that related to the migraines. I treated the shun disturbance in Chinese medicine, spiritual level shun disturbance caused by chronic pain. The shun has become dull in Chinese medicine terms and requires classical Chinese medicine and psychological help. The couple her and her husband received couples counseling to restore harmony in the relationship and stress from dealing with her chronic condition and her daughter's issues. Okay. At each intervention, let me just, okay, I'm missing. At each intervention, I follow the process. Remember, I said if it's out of whack, as it comes in, you have to follow how it's affecting everything else and where you intervene next. So that's what I'm doing. And you see which intervention is required. You educate constantly and engage the patient as an active participant in the healing process because the education is required to shift the patient's consciousness. And the ultimate healing is achieved when the deepest root of the disease is found, addressed, and shifted. Okay. So the auricular exam findings. So when she came in, I knew nothing about her case. And the assistant had all of the paperwork. And what I found, just by looking at her ear, her menses was due. She had left fallopian tube blockage. Her right ovary was swollen. She had some issues in terms of her elimination. So alternating constipation, diarrhea. She has sinusitis, dry throat, chronic recurrent allergies, inflamed duodenum, causing slight hypoglycemia, sensitive stomach, minor hemorrhoids. She had anxiety and depression. This is all on the ear, okay? Occipital headache, some frontal headache, dizziness. Her C1 is slightly out, causing some dizziness. Her left shoulder, scapular area, and neck inflamed. Left elbow, her right fingers inflamed. She had glaucoma on both left and right side, with the right side worse. She had some tinnitus on the right. I was evaluating possible hypothyroid uterine prolapse. All of this was just the initial auricular exam. Then a TCM exam for time. I'm not going to go into detail, but got a lot of her menses information. She had leukorrhea. Oh, the other thing I found on the auricular exam is a tooth. So she had just been to the dentist and told me that everything was fixed. There was no more problems. And I said, no, you have a cavity, whatever tooth I identified. And I sent her back to the dentist, and she did have another cavity. It's really fascinating, auricular. So then tongue and pulse Chinese medicine. And then I referred the patient to her gynecologist to check the left fallopian tube blockage and glaucoma, thyroid function labs, referred to the dentist for right lower jaw tooth decay. Met with a patient for psychotherapy, just a few sessions to address the relationship and daughter's issues. There's the TCM diagnosis and treatment plan. I treated with auricular medicine, with ear seeds, with traditional acupuncture, transcendental acupuncture, herbal formulas, and within 4 months, she was off bioidenticals. She was sleeping through the night for the first time, maybe in her life. And her menses were regular. The perimenopause symptoms were eliminated. Her migraines were severely reduced. She was off any medication, any Western medication at all, even not even taking Excedrin, because the migraines were so reduced. So the treatment for Chinese medicine terms was tonify spleen, kidney, qi, the blood and yin, reduce heat in the heart, calm the shen, and 5 spirit communication. So, and transcendental acupuncture, this is an example of the transcendental acupuncture treatment. Transcendental acupuncture, even though it's focused on the spiritual, mental, emotional aspects, is also treating the body. In Chinese medicine, you are never not. You are always treating the whole Megillah. My focus here was not the physical body, but also it was treating the leukorrhea, worry, oppression, the extinguishing the wind to the head, and descending wind phlegm having to do with migraines. So there's also always physical, emotional. So the results after the 4 months, and all of her symptoms were, she had more energy than she'd ever had. She was sleeping, she was functioning, she was working. Then the next thing to come up was that she had been molested by her dentist for a year, because due to the way that she was raised, she couldn't tell anyone. She couldn't tell her parents. She couldn't tell anyone. So the molestation kept happening. And she had suppressed that knowledge. So coming in, she didn't even know it. But as part of Transcendental Essence's diagnosis, it was revealed, and she was ready to go to the next deeper level of psychotherapy and transcendental therapy. And as a result of this, and then she was ready to be treated for the prolapse and the glaucoma. The glaucoma was not eliminated, but it was stopped. So it didn't get any worse. I think it was slightly improved and then stayed there. And again, with the prolapse, it was not eliminated, but it was prevented from getting any worse. So that is the case. So I just wanted to close with this, because transcendental medicine sees the whole picture. I intuit a gestalt of the healing process involves mind, body, spirit. I get a sense of when to intervene at what level so that it proceeds. Because if you treat the physical before the mental is ready, you won't get anywhere. If you treat the mental before the physical is level, you won't get anywhere. So you have to see the whole thing. And I treat with the many tools listed. And then what happens is it creates an upward healing spiral where each level supports the next to move forward and transform. As the spirit is healed, the body opens. As the body is healed, the emotions stabilize, the chi flows, the mind settles down, and the spirit re-inhabits the body with a deep level of empowerment. So that's it. There you go. So I'm going to stop the recording and stop the sharing.